The next bit that I want to talk about is some of the processes that you will need to do, that you have to do before you can become a physiotherapist. Physiotherapy as a profession is very well regulated, quite rightly so. So for example, for Isaac to start the program, we have a department called student onboarding who are fantastic. They will, once Isaac gets an offer from us, he will start to get messages from student onboarding. They will tell him what to do. So for example, he will need, because he's an international student, he will need a letter of good conduct from the Hong Kong Police Authority or Association. There may be another check done over here. We were talking before, you had to go and get a check in Oldham as well. And if you're a UK student, or you're not an international, it's called a DBS, Disclosure and Barring Service, because you will be working with vulnerable adults and children. So we need to make sure that you are of good character, really. That is all done by the student onboarding team. The other important thing is health. So you will be asked to declare your health status. You will also need to show evidence of your immunisations and vaccinations as a child. I'm not going to go into huge detail here, but I just spoke to the onboarding team this morning and they wanted to stress to you that it's far easier for you to bring, when you come to the UK, bring all of your childhood medical records with you, all your vaccination records. The onboarding system here are very good, very efficient, and all I will say is that if you get an email from student onboarding, do it. If you don't do what they say, you will not be allowed to go on placement. If you are not allowed to go on placement, you are not allowed to graduate. If you are not allowed to graduate, you will not become a physiotherapist. So that's how important it is. And if you don't follow these guidelines, you will be stopped from going on placement. So it's extremely important. Isaac didn't have any issues with it, but I just wanted to mention that. So the whole onboarding process is very, very efficient. They will come in, they will send you emails in the summer. They usually come in induction week if possible to talk to you guys as well. And they have kind of an open door policy. They are so helpful because it is so important that you have to get these extra checks and things done. There's also things like ordering uniforms. So onboarding look after that as well. And other bits of training that you have to do, you just have to do it before you can, become a physiotherapist. How did you find the process of vaccinations, DBS, enhanced? Was that difficult or was that fairly straightforward?
Okay, I mean, for my case, because I was in the UK, when I'm going to apply all of this thing, so that'll be quite complicated. You're going to apply the CNCC, that's what we call the good conduct letter.
Yep.
In Hong Kong, from Hong Kong. But okay, I'm just a special case for me. So, but if you are the Hong Kong student, you applied it in Hong Kong and you are in Hong Kong, you're trying to apply the good conduct letter from the Hong Kong Police Force, that will be more easier. Just follow the instruction from the student on board. And I mean, from this year now on, the Hong Kong Police Force, they get a new approaches for apply to the CNCC, the good conduct letter. They allow you to apply online right now. So if you are really in overseas, you can apply it online. You don't have to, like me, to send over my fingerprints, anything else in paper in Hong Kong and send it to the Hong Kong police station. You don't have to do that. It becomes more convenient. Yeah. So for the vaccination, because I was born in China, so they don't use any kind of electronic record. They do it on the written paper. They written on the paper. They have written that. So it's quite ugly. I mean, the works. So no one wants to translate that. I can't translate that. So I just tell to the clinic, the vaccination clinic in here. I just said, no, I don't have the record. You can do all again. So I mean, because I'm 25 now, the antibodies inside my body will be quite low. So I heard some of the students say even they got the report, they got a record of that, you need to do a dose of the blood test to test about the antibodies. So, but that's quite convenient. Yeah.
The reason that we have to get you checked against your immunisation status is two reasons really. Number one, you are going to be going into hospitals with patients who have infectious diseases. So we need to make sure that you're as protected as possible against things like TB, hepatitis B, measles, mumps and rubella, that kind of thing. And also you will be treating people who are immunocompromised, so who have very weak immune systems. So you have to think about your duty to the public. So, you know, we need to make sure that we are protecting the public from Isaac. That sounded wrong, but you know what I mean? And also protecting Isaac from patients as well, so it is extremely important. But onboarding will start contacting you. All I will say from my point of view is that I need you to not ignore the emails that you get from student onboarding. The other thing that I wanted to add as well is the start date at university varies slightly every year. A couple of years ago, we brought forward the start of the academic term. Now, we start a little bit earlier than a lot of universities do. So next year, in 2025, I did some checking before, we will start on the 8th of September. I need Isaac last year to be ready on the 8th of September. I need him to be here. Socially, it's important that Isaac gets to meet us and meet his classmates. We cover a lot in the first week. A lot of it is full on. It's the kind of course where you can't afford to miss anything. Lectures are not optional. No sessions are optional. Nothing that we teach is irrelevant. And there is a direct correlation between attendance and how well students do. And Isaac's attendance has been fabulous, which is one of the reasons why he's doing so well. But I'm just making a note for you now that if you do decide to come to us, I need you to be ready here in induction week, at the start of induction week. Obviously, people get sick, people need hospital appointments, we get that, but we do monitor attendance extremely closely because it's important, it's a professional course, and there's a direct correlation between attendance and how well students do. Okay, thank you.